everyone. The panelists can unmute themselves. You are requested to put your comments and questions in the chat box. And welcome to the 60th edition. I think अब हम geriatric range में पहुंच रहे हैं. Welcome to this music therapy session. Next slide, please. I would hand over to Dr. Tofan Pati sir. Sir, over to you. We are saving on our introductions and giving it to you, sir. Sir, you have to unmute.
Thank you very much, Ali. So we are to the 60th edition, and but I would like to correct Ali. We are still young. We have to evolve a lot. And next slide, please, Pawan. I have to introduce briefly, very briefly, two vibrant moderators of the series: Dr. Amrit Pat Joshi, Professor of Psychiatry in High Tech Medical College and direct TC member, and Dr. Alim Siddiqui from Lucknow, who is also Professor of Psychiatry, and he had been a direct council member in the previous year. And we have got very vibrant and very important, very senior Director of Psychiatry as our chairpersons, Dr. Pranab Kumar Dalal. Next slide, please. Dr. P.K. Dalal, immediate past president of Indian Psychiatric Society, is former professor and HOD of psychiatry for over 10 years in the Department of Psychiatry, King George Medical University, Lucknow, a medical school since 1905. He had been in charge of the de-addiction psychiatry at KGMU. Over 135 publications in different national and international journals and several book chapters. Number of projects carried out 27. Manuscript reviewer for national and international journals. Recipient of several awards. Area of interest, adult psychiatry and addiction psychiatry. A few of the awards: Dr. B.B. Sethi Oration Award, Tara Naidu Award of IPS Central Zone, Professor A.D. Engineer Award, KGM Award of Excellence. He had been the president of IPS Central Zone 2004 to 5 and editor of IPS Central Zone 1997 to 2003. Welcome, sir. Welcome, Dr. Dalal. And we have with us our ever singing Dr. I.R. Rajkumar of Baroda. He is a consultant psychiatry in Alpha Healing Center, Baroda, over a long time, and is a frequent face in all MCs, and he's a frequent singing and smiling face. His MBBS from Jain Medical College, Belgaum, MD DPM, KM Hospital, Setcore Medical College, Mumbai. JC Marfata Gold Medal in MD in 1982 from Bombay University. With this, we have Dr. Rajkumar, and I hand over the further proceedings to our senior chairpersons, Dr. P.K. Dalal and Dr. I.R. Rajkumar. Over to you.
Thank you, sir, for a very candid introduction. And my dear friends, you all know that we are having a very musical chairperson as well as speaker. So at the end of the day, we will be having a brief, singing competition between the two. That is my proposal. I think everybody will accept that. And now it is my pleasant duty to introduce today's speaker. And before that, I will say that...
Just 2 seconds. Just 2 seconds. Both of our chairpersons are very good singers. Okay.
Before this, kudos to the organizers, and this is 60th edition of their program, and which is continuously going on for last 60 weeks. So it is a yeoman task. And now it is my pleasant duty to introduce Dr. Sudhir Bhave. He is Professor, Department of Psychiatry, NKP Salve Institute of Medical Sciences, Nagpur, 34 years of experience, postgraduate guide and MD examiner, topped almost all exams in his school and college years, National Executive Committee member, IPS, winner of LP Shah Oration Award, IPS West Zone, Nagpur Bhushan Award, published 26 papers in index journals and authored 7 book chapters, edited the first book in the world of cyber psychiatry for the Indian Psychiatric Society, an acclaimed light music vocalist, and cut an album of his songs 2010. So with this brief introduction, I would invite our chairperson, Dr. Raj Kumar Saab, to say a few words and then hand over the mic to Professor Sudhir Bhave. Thank you.
Good evening to all of you. There might be a little disturbance at the background because today's some Ganesh Visarjan also is going on. So music is there at the background, perhaps befitting the talk that is going to unfold from Sudhir. Yes, music has been an integral part of the Indian society at least. If you take up even the Puranas and the Vedas, music did have a role there and has been practiced knowingly or unknowingly by each one of us in some or the other way. And if you ask me personally, yes, it has been always a soothing effect to sing, to enjoy the music. And I am sure Sudhir will take us into the nitty-gritty of it and enlighten us of the role of music in today's life or to humanity as a therapy module. Yes, Sudhir, the floor is on to you.
Thank you very much, sir. I'll, I think, start sharing my slides. Are they visible?
Yes, sir, it's visible.
Right. And the pointer is also visible, right?
Yes.
Pointer visible?
Yes, sir.
Yes, yes.
So, thank you. I profusely thank Dr. Tufan Pati and his team for giving me this wonderful opportunity, which somewhere in the heart of my heart, I was imagining one day I'll be talking on this treatment modality. And big thanks to both the chairpersons, both very revered people for me in IPS. Dr. Tufan Pati very graciously had left the choice of the topic on me. He said, whatever in therapy that you are interested in, you can talk on that. So I thought that perhaps music is, I cannot call it my forte, but an area in which I have been interested in ever since I think I was 5 or 6 years old. And many of the IPS members have seen me talk on music and sing and so on. And I have studied music therapy to some extent. I would not say that I'm a music therapist technically, but yeah, I have done some research in music therapy. I have read something about that. So we come to this subject. And as you can see, the topic that I have mentioned is an ancient remedy and a modern therapy. I think I do not have to emphasize that we all love music. And these kind of phrases like music energizes me, takes away the blues, etc. are very common. There are some people who say कि यार मैं तो non-musical हूँ या मेरे को music समझता नहीं है. But let me clarify that every single individual has an innate musicality. Every single person. You may not be a good singer. You may not be a good person who can understand music grammatically. But musicality is there. Now, if I say Deewana hua badal sawan ki ghata chai, and if I say Deewana hua badal sawan ki ghata chai, and if I ask this person ki dono mein se song kaun sa tha, he's certainly going to say the second one. So, which means that he has his brain has comprehended the musical elements of this. So, basically, each one of us has a basic musicality. Something on music, some basics, like when do we start appreciating music? It's interesting to note that we start appreciating music in the second trimester of pregnancy when we are in the womb. And we are able to differentiate between different types of music in third trimester. Roughly, it has been calculated that about 2 weeks before the delivery, because pregnant women about 2 weeks prior to their, I'll tell you how it's known, prior to their delivery, we are made to listen to a particular kind of music. And then there was another kind of music that was very commonly played at the neighbor's house. And the fetus responded more vigorously to the tune that he had been hearing commonly. So even at that very young age, it's very difficult to conceptualize, to imagine as to how that happens, but that does. I'm often asked this question, कि music कब शुरू हुआ? Like in human history, when did music start? Now we do not have a definitive answer to that. But one guess is that it started in something called Upper Paleolithic era. Upper Paleolithic era happens somewhere between 50,000 BC to 18,000 BC. And experts say that perhaps when two hunter-gatherers, they started striking stone in a rhythm, probably that was the first percussion instrument and perhaps the first appreciation of music that began. But we can never be sure about these things. In fact, I was astounded to know that the first recorded musical instrument dates back to 43,000 BC. Now that's really deep ancient. And now that's about the musical instrument. We can never know as to when human beings started singing, because fossils cannot tell you as to when singing started. But in instruments, we do have the proof of some concrete proof of something that happened musically. So basically, music has been a very old thing. Now, why did music evolve? Evolutionary biologists, they agree that a trait, a phenotypic trait evolves only if it has got a survival value. Now, does music have a survival value? Directly, no. Even if I can't sing well, even if I'm not able to appreciate music adequately, I do have progeny, I do pass on my genes to the next generation. So why exactly did it evolve? Because it doesn't seem to have a survival value. But then experts theorize that probably it has an indirect survival value. Like, for example, there are many theories about that. I'll just quote a few examples. Like Jeffrey Miller from New Mexico, he says that music aided in courtship. So if a male or a female sang to each other in their own primitive way, then that brought them together and that increased the chances of mating. So maybe music acts as a kind of romantic bond, which has a survival value. Or maybe music helped in social cohesions, because prehistory tells us that in hunter-gatherer societies, say dating back to 50,000 BC or 1 lakh BC, initially there used to be small groups of hunter-gatherers which would go on hunting. But slowly, Homo sapiens realized that the groups need to be bigger to defend yourself against the enemy, or maybe to hunt animals which are difficult for only a small number of people to really kill. And music, if created socially, helps in this kind of social bonding. And this kind of social bonding is definitely has a survival value. Or maybe some people think that it's only a byproduct of evolution. There is something called spandrel. Spandrel are evolutionary byproducts. They are not the traits chosen by natural selection, but they are just byproduct of something else. Like they say commonly about language, that language did not have an evolution of its own, an evolutionary trajectory, but language evolved only as a byproduct of evolution of other cognitive abilities. And we were lucky that the language sprang off from this cognitive evolution. So there are different theories about why music evolved, but perhaps, as I said earlier, it does have an indirect survival value. Now, before we go on to music therapy, something on music and brain. It's very important to understand, basically, I mean, especially for us as psychiatrists, people who deal with brain, as to how does the brain analyze music? Now, when I hear my favorite tune, what exactly happens in the brain? A large part of understanding of the brain equivalent of music comes from cerebral pathology, in which specific pathologies impair specific part of musicality. Like they have defined at least 15, 16 kinds of musical pathologies. Like if this area of the brain is affected, the sense of rhythm is lost. If this area is affected, the sense of tonality is lost, and so on. I think Oliver Sacks, the famous neurologist who has written many very interesting books for lay people on different aspects of neurology. I'm sure many of you must have read Oliver Sacks. He has written a book called Musicophilia. I'll recommend this to all of you. In fact, it's meant for anyone interested in music. And he outlines in very lucid language as to how brain pathology can lead to difficulties with interpretation of music, perception of music. Music is processed by the brain through several pathways. It's not a single pathway. There is a perceptual processing, there's an emotional processing, and autonomic processing that affects basically the sympathetic and the parasympathetic nervous system. There is a cognitive processing. We think about music. We think about the musical piece that we are going to hear. And then there's a motor processing. I'll handle each of these very briefly, one by one. First is the perceptual processing. Now, everything here may not be very clear, but I think let me just suffice it to say that music enters the ear, reaches the cochlea, and then reaches the something called primary auditory cortex. Primary auditory cortex analyzes the pitch and the contour of music. I think we all understand pitch. For seniors, Hemant Kumar singing was low pitch and Narendra Chanchal singing was high pitch. So the primary auditory cortex can differentiate between the pitch and the contour. Contour basically is a tune of a composition. And from primary auditory cortex, it goes to secondary auditory cortex and other auditory association areas where more fine perceptions of music are decided, like the melody, is it melodious? The rhythm, is the sense of rhythm being lost in this song, or rhythm is intact in this song, and those kind of things. So perceptually, primary auditory area, secondary auditory area, and other auditory projections to other parts of the brain. I'll come to them later on. So this is a brief overview of the perceptual processing. Then emotional processing. Music, of course, has a very great emotional value. Now, we basically enjoy music because of the emotional value, largely. And the music association areas, the auditory association areas, they go to parts of limbic system, like amygdala, the cingulate gyrus, the medial orbitofrontal cortex. And it is these areas that make us appreciate the emotional equivalent of the music. Now, if I hear Deewana Hua Badal Sawan Ki Ghata Chai, or agar main jhoomne lagta hoon, so it is basically these parts of the limbic system which are getting input from the primary auditory area. Then, yeah, there is something interesting. Every song has a repetition built into it. Like we know that the rhythm has a repetition. कोई गाना अगर त्रिताल में चल रहा है या दादरा में चल रहा है तो दादरा चलता रहेगा. And there's an inbuilt repetition. And very importantly, there's an element of predictability which is very pleasurable. Now, this is often not known that anticipation has a huge role to play in music appreciation. How? Like, if I'm sorry, I'm coming back to the same song, maybe because many people know it. If the radio announcer says कि अब आप सुनिए कश्मीर की कली का गाना, संगीतकार हैं O.P. नैयर, गायक हैं मोहम्मद रफी और आशा भोसले, and then you anticipate कि अब दीवाना हुआ बादल सावन की घटा छाई आ सकता है, you become very happy. As the song starts, you start enjoying it. Why do you enjoy the entire song? Because you are anticipating subsequent notes. अब अगर मैं बोलता हूँ लाइक फॉर दीवाना हुआ बादल, अगर मैं कहूँ दी में कुछ रखा नहीं है. नाउ दी इज अ नोट, पर्टिकुलर नोट, बट मजा एंटिसिपेशन में है. व्हेन आई से दी, द एंटिसिपेशन इज कि अब वो नोट्स आने वाले हैं जो दीवाना हुआ बादल पे जाने वाले. So this anticipation has a very big role in appreciation of music. Then third, of course, is autonomic processing. We know that some kind of music increases the heart rate, increases the blood pressure, and the various autonomic parameters, and the tempo decides that. So slow and soft music will tone down the sympathetic nervous system, and a faster tempo will increase the heart rate, the minute ventilation, the blood pressure, etc. Now, this is something very interesting. What I mentioned here is that the brainstem neurons, they fire synchronously with the tempo. So interesting. Like if I listen to a fast song, a song with a rapid tempo, fast tempo, like I listen to Aja Aja, Main Hoon Pyar Tera, Allah Allah, Dildar Tera, fast tempo. And what happens is brainstem neurons start firing with them. The centers that control respiration, the cardiac rate, etc. Now, why does that happen? Now, this again is interesting. The brain associates fast tempo music as signals related to survival. If we go back in the evolution, say at a time, for example, 6 million years ago, we and today's monkeys had a common ancestor, 6 million years back. Now imagine, say around that time, if there's a tiger coming running at us, we start running, and the things are very rapid, the pace of running is very rapid, and the brainstem has learned to respond to that with an increase in all sympathetic variables. So any fast tempo music, by evolutionary hardwiring, elicits that kind of response. So we have fast beating heart, our BP goes up, the tempo is high. And the opposite would happen with a relaxing music. Like sympathetic hyperactivity comes down, it becomes rather hypoactivity. Typical examples would be the purring of a cat. A cat would purr very softly with a tempo which is slow. Or the language, the musical language that a mother uses with a child. Now mothers use a kind of language that includes coochie cooing, that includes a lot of prosody. And you imagine the kind of things that a mother says to a very small infant, a small baby, and it has got a musicality inherent to it, and it goes in a slow tempo. So the brainstem knows that this is something which is not threatening, and so the sympathetic tone comes down. So that's a part of the autonomic processing. Motor processing, we all know that we start tapping our hands or feet in response to music. The more extroverts amongst us, we get up and start dancing to whatever tune is going on. So that's motor processing. And this basically happens because the musical pathway travels to cerebellum, the basal ganglia, and the frontal cortex, where we have this motor area. So we have this coordinated, very rhythmic response to music in motor processing. This diagram very nicely illustrates the different parts of the brain and the way they are involved in music. Something interesting is that music is an activity which involves the largest number of areas in the brain. Now that's very interesting. Any other kind of activity, you might be doing something fast, you could be running, you could be in a gym, or you could be fighting with someone, but the number of brain areas involved are not as many as those involved in music. Now I have mentioned some of them, but let me again kind of re-emphasize, like this motor cortex you can see here. So movement, foot tapping, dancing, etc. Prefrontal cortex, creation of expectation, violation of expectation. You are like, for example, people who are interested in क्लासिकल म्यूजिक, एक पर्टिकुलर राग चल रहा है, राग यमन चल रहा है, और यमन के चलते चलते अचानक एक ऐसा one particular note comes which sounds dissonant to the ongoing yaman. Now even this note which is dissonant, if placed intelligently and creatively, that can create a pleasure. So the basic anticipation of yaman is being violated, but if used intelligently, it can work wonders. And these lower centers, they are basically parts of limbic system which are involved in pleasure. Hippocampus deals with the memory of music. So memory has a lot of role to play in anticipation. I know which is my favorite song that's coming on, so I'm going to enjoy it, and so on. Another diagram that shows the musical pathway, like it enters the cochlear nucleus, and from there it traverses to different areas, the cerebellum and the basal ganglia, and the motor cortex for the rhythm part of it, the limbic system part for emotional processing, the frontal cortex part for the cognitive processing, and again, rhythmic movements. Right. So basically, now I must state that I'm trying to put things in a nutshell. The subject is very vast, and I was finding it difficult as to kya bolu or kya na bolu. But then I've tried to kind of abbreviate things so that I can finish in time. Now coming to music therapy. Music and healing have a very long history. Like on the left side, you can see ancient kind of civilizations where shamans used to use music or chantings to please the gods and so on. And this was supposed to have a healing property. In fact, all civilizations in which we know about ancient music, when I say ancient, it goes back to 2000, 3000 years, like in India, China, Egypt, then Persia, and so on. Now, we have documentation from these areas that in say 2000 BC or 1500 BC, music was used for treatment. And of course, it has a long history which has come down to formal music therapy today. Now, what exactly is music therapy? If you want to define it, it's a clinical and evidence-based use of music and or its elements by a qualified music therapist to accomplish individualized goals within a therapeutic relationship with one client or a group. Now, that's a definition given by something called the World Federation of Music Therapy. I think the important things to look here are, it has to be evidence-based. One can't just say that I'll use this rag to cure this patient. Now, you should be able to show evidence that this particular rag does help with this kind of a condition. So unless there is evidence base, our modern science is not going to recognize as a music therapy. And secondly, very importantly, it has got to be a qualified music therapist. Now, these are quite rare to come by, not only in India, but all over the world. Like we do use music in different ways, which I'll come to later, but qualified music therapists are very rare. Qualified music therapist distinguishes music therapy from music medicine. Now, what is music medicine? Music medicine is the use of music as a supplementary therapy. Now, many of us, we use music in our waiting room for the patients, or have a background music in the indoor part of the hospital. Now, that is not music therapy, but that is music medicine. You are merely using music as a supplementary part of the entire treatment. You want the patient to be relaxed, you want the patient to be more cheerful, hoping that it will aid in therapy. There are different types of music therapies. Many different types have been defined. I won't go in great detail, but just to suffice, just some examples, like who creates the music. It can be active music therapy or receptive music therapy. Active therapy basically means that here the client makes music. I, as a music therapist, ask the client to either play an instrument or sing, either singly or maybe in a group. And receptive is when he or she listens to music. Receptive is more common because most of us are not experts in music, most of the clients. Or it can be based on the level of structuring, like how structured are the sessions. It's called structured if the session is pre-planned as to what is going to be done in our coming session and what are the kind of activities that are going to be done. Or it can be flexible, like you decide what is going to be played during therapy. Like for example, in structured therapy, I might tell the clients that next time when we meet, we are going to discuss and play some of the music by A.R. Rahman. And these are the compositions that we are going to take the help of. In flexible, I'll just tell them that, okay, let's decide next time. So when we meet, then I say, okay, let's think of A.R. Rahman songs. Then someone sings, then someone tries to analyze that. And the whole group enjoys it and kind of shares the joy of that. Now, when did music therapy begin? it is generally believed that it began after Second World War. Now, here you can see post Second World War, these are a group of American chorus singers who are trying to regale the patients of World War II. And this was supposed to help patients recover from the war trauma. So the history dates back to something like 1946. They have the first records of this kind of music. But I would like to emphasize here, I think at many places, India is kind of neglected when it comes to world history of anything. And I think it's a matter of great pride that our own Central Institute of Psychiatry, Ranchi, it started its weekly dance and music sessions since 1918. So music was being used to help psychiatric patients even then. And since 1920s, CIP Ranchi has had its own band. Now, very unfortunately, when I went through the history, world history of music therapy, I didn't find mention of this almost anywhere. So I think there is much to be proud of when it comes to music therapy, in modern music therapy in the Indian setting. Coming to local music therapy in India, Indian system slightly differs from the Western system, and the music therapists of India, they define it as an individualistic, subjective, and spiritual art aiming at personal harmony with one's being, and not at symphonic elaborations. Let me explain that in typical Indian music therapy, you can imagine that the notes of a tanpura are going on in the background, and then a vocal vilambit alap of rag Yaman comes along, and it creates a very kind of serene and calm atmosphere. And the client is made to lie down with eyes closed, listen to it, as they say, enter the flow of it, and imbibe the music in his or her mind and brain. So that's a kind of Indian music therapy, typical. Whereas in the Western thing, many people sitting together, creating music, playing, discussing it, and so on. So it is more subjective, it is more individualized, and in the Indian context, it is supposed to have more spiritual value. Because in both Hindustani and Carnatic music, the two main styles of Indian classical music, devotional music is a very important part. And in the history of music therapy in India, you can find devotional music as a very strong presence. The most common approach in India is the rag-based approach. So you play a particular rag to a particular patient, and he benefits with that rag. Now, what is a rag basically? I'm sure all of us have heard this word ki rag. Kai log usko raga bhi bolte hain, which I kind of hate. It's not raga, it's rag. And we have read about this rag curing this and that rag treating that. Rag basically is a collection of notes. Swar in Hindustani or Karnataka is called note in English. So basically a collection of specific notes rendered in a specific manner. It's not only what note. Sa re ga dha hai keval, that's not enough. But how does the chalan go? Chalan is the way the swars progress. A brief example, like say Rag Bhupali. Rag Bhupali is a famous Hindustani rag. Rag Bhupali has this kind of chalan. Ga re sa dha sa re ga pa ga dha pa ga re sa ga re sa dha sa re ga pa ga dha pa ga re sa. Now these are all live within the 7 notes. Sa re ga ma pa dha ni sa. But the specific way in which these notes are presented, that is what makes Rag Bhupali. So it is not the individual notes, but the gestalt of it, the way the whole thing is presented. We hear कि ये गाना इस राग पे आधारित है, लागा चुनरी में दाग राग भैरवी पे आधारित है. Now what does that mean? Now listen to this. Ga re sa dha sa re ga pa ga dha pa ga re sa. And listen to this. कांची रे प्रीत मेरी साची रुक जाना जा दिल तोड़ के. और संसार की हर शय का इतना ही फसाना है, एक धुंध से आना है, एक धुंध से जाना है. ग रे सा ध सा रे ग प ग ध प ग रे sa. You can make out that the chalan that I am verbalizing in its tune is very similar to the songs that I sang. So we can say that Kanchire Pritamari Sanchi is based on Rag Bhupali. So that's how it works. And research on rag-based therapy has shown that rag-based music has been found to be stimulating, anxiolytic, sedating, and increasing attention. These are the kind of emotional and neuropsychological benefits that have accrued out of rag-based music. And this is all documented in evidence-based in journals. Music therapy has been used in a large number of physical illnesses. I have mentioned a few here, very commonly neurological disorders, hypertension, and so on. But it has also been used in psychiatric illnesses. So a few words on psychiatric illnesses and music therapy. Now, again, I can't go in detail, but just an overview of where can music therapy be used in psychiatry. Depression and music therapy. Now, interestingly, there are Cochrane reviews for some of the major mental illnesses and the use of music therapy in them. The Cochrane review a few years back had 5 randomized studies in music therapy for depression, and that did show significant improvement in something as severe as MDD. Dosage has been shown to be important in music therapy, which basically means that the number of sessions that have taken place is very important. For example, music therapy done every single day of the week has been found to be much more effective than music therapy done less often, say once or twice in a week. So as I mentioned here, the efficacy, 73% of it, 73% of the variance is based on this single variable of how common these sessions are. There are Indian studies. Deshmukh et al. Used, he did that with 50 patients with MDD, rag-based, and showed that the efficacy of music therapy was same as psychotropics. In fact, I had headed a study on music therapy, use of light music. Light music has, as far as I know, not at all been commonly used in our country. And this was largely film music. And I think that this was perhaps the first study in the world on Hindi film music used as music therapy. We had a control group, one with only antidepressants and the second with antidepressants with music therapy. I cannot enumerate all the details here because of want of time, but for someone who is interested, I can communicate with them. And it was shown that the group which had music therapy with antidepressants had significantly more benefit than the group in which only antidepressants were used, with a p-value of less than 0.05. I was invited to an international conference on music therapy, and it was there that I presented this particular work on light music. In this conference, on which was exclusively on music therapy, I was astounded to see that doctors, it was an international conference, and doctors from all over the world have been using music therapy very effectively and very innovatively. And I think it was a wonderful experience. Schizophrenia and music therapy. Now, index journals cite more than 30 studies. Cochrane review has 8 RCTs. The effects which are seen in schizophrenia are more on negative symptoms and affective symptoms rather than positive symptoms. There's only one study which states that the hallucinations decrease in frequency and intensity. Now, this study had employed very loud music with a fast tempo, and that the authors claim somehow influenced the severity of the hallucinations. Indian studies are also there. two, as far as I know, two have been published so far, which show improvement in the same areas of affective components and negative symptoms. Dementia and music therapy. Cochrane review has 10 RCTs. In dementia, the core symptom of cognitive difficulties did not seem to benefit, but it was more of the related symptoms like behavioral symptoms and mood symptoms, anxiety and insomnia and things like that, which did benefit. In fact, as I mentioned, even the motor skills for patients of dementia who played musical instruments regularly during music therapy, their motor skills improved. Pediatric population shows much use of music therapy, and in fact, in certain conditions like depression, adolescents are known to respond better to music therapy than adults. I'll just mention some of the conditions in which music therapy has been used. ADHD has contrasting findings, like some studies found a beneficial effect on concentration and hyperactivity, some did not. Autism, there was significant improvement in some studies, especially in social and communication skills. I'll tell in some detail later on as to why that happened. There are studies that show that dyslexics had better reading skills after music therapy. Epileptiform discharges have been known to decrease with music therapy. So again, it's a good number of studies, though not a very large number, but then studies enough to convince us that maybe music therapy has a role and this needs to be explored further. Now, how does music therapy work? I am suffering from, say, depression and I listen to music. How exactly does it work? There are many ways. We know that music is largely a vehicle of emotional expression. Music is all about bhav. Like even take a film song or any light music song. Ragdari mein to khair, there is no question. But any light music song, the words, the lyrics simply act as a vehicle for the emotion that is carried. If you sing Kasme Wade Pyar Wafa Sab Baatein Hain Baaton Ka Kya, it's basically melancholy, which is merely using words as a vehicle for that expression. So perhaps this aspect of music helps emotional enrichment in a patient who has got, who's kind of impaired of emotions, deprived of emotions. Music, as I said earlier, has got a great social value. A group of clients making music or listening to music together, enjoying music, it creates a more social bonding. And this kind of social use of music therapy, it is known to decrease social deficits. Music could help with motivation because basically music itself is a motivation. If I'm attempting to listen to a song, if I am trying to enjoy a song, I'm gently pushing myself to do that. And that might be helping increase the motivation. For people who are lacking pleasure in life, for people who experience symptoms like anhedonia, the aesthetic experience of music, it can help induce some kind of a pleasure element in the otherwise emotionally impoverished life of the patient. As I mentioned earlier, motor coordination can improve in dementia, playing musical instruments. In fact, it has been shown that using musical instruments to create music has been shown to affect the brain in more ways than simply listening to music or singing. Because when we play an instrument, we are using all aspects of music in addition to the motor aspect. I'm using my fingers and my hands, gross and fine movements to create music. And when this is repeated multiple times, then, more areas of brain are being used. In dementia, it helps the development of articulation. I mean, improving articulation, because articulation could partly be lost, but then repeatedly singing the same lyrics again and again, that is supposed to help with articulation. The sense of rhythm is supposed to be held, which is slowly lost in dementia. And interestingly, musical rhythm also helps organize time and space, because the rhythm is all about time and spacing of the particular musical notes. So this helps a degenerating brain. In autism, there are various ways in which music could be helping. Like we know of the communication deficits in these people, and it could help in communication. If there is a autistic child with a higher IQ, then the meaning of the lyrics and what the composer had in mind could be discussed with the child. And this helps in the development of the theory of mind. As you know, I mean, looking at the other person as someone who possesses mind and can think in these ways, like us. Or thirdly, music can have a neo-parental role, which basically means that in the case of every child, before the verbal expression takes place, it is basically the musical communication that happens between the parents and the child. Like I discussed motherese earlier, mother singing to the child, singing lullabies, or using prosody in her little small communications with the child. So that precedes the language. And finally, musical treatments are engrossing and rewarding, naturally. It has been claimed that patients who are enrolled in music therapy sessions, they participate more with more motivation as compared to other kinds of therapies, because music is innately rewarding, innately enriching. So these are various ways it could be working. Coming to something that I called music medicine earlier, when one need not be a trained music therapist, but where one can use music as a supplementary in a supplementary role. Like this is for all of us. These are some ways in which we can use music, not only psychiatrists, but doctors in general. It can be used in the waiting room. It relaxes patients. It brings slight cheer to them if you choose the right kind of music. In patient rooms, it can be used. In fact, at NKP Salve Institute of Medical Sciences, we have been doing this for the past many years. We have piped in music in all the wards where the patients through most of the day, they listen to some peaceful bansuri or santoor with a slow kind of pace. Group singing can be used. In our ward, we have daily sessions of bhajan singing in the morning. And we believe that they do help. Dancing to music. In the COVID times, I think many of us have seen these wonderful and very heartwarming videos of doctors dancing with the patients. It is used by surgeons very commonly in operation theatre. How can we doctors personally use music to our benefit? Of course, during any chores. If you are doing a boring chore, then music always helps. I make it a point that when I'm doing some boring chore, like rearranging my almirah or rearranging my papers, I put some kind of music I love in the background. So it makes the chore less drab, less boring. Mindful listening. So you listen to something with closed eyes and focus on the notes, focus on the tune, focus on the lyrics. That helps. That helps you relax. Creating music, as I said earlier, like you can create music with your friends. We doctors do play antakshari. Many of us are parts of orchestras. Even discussing music. Discussing music is pleasurable. For those of us who have a little understanding or perhaps more appreciation of music, for example, when I discuss the style of O.P. Nayyar or the style of Shankar Jaikishan with any of my friends who are interested in music, those times are very regaling times, very, very enjoyable times. And of course, dancing to music, using music while exercising. So these are some ways which we doctors can use to enrich our own life with music. And of course, singing in the shower. Shower mein gana is something that comes very naturally to us. And many of us sing in shower for various reasons. One is the sound of the water, it drowns our voice. So whatever little mistakes you are doing while singing, they get drowned. Secondly, there is something called reverb in musical lingo. There is a slight echo generally in the bathrooms. And the echo also tends to tone down the weaker areas of your singing and so on. And of course, it's enjoyable. You can sing loudly with a pseudo security that no one is listening. It's only you. So I'll strongly recommend shower singing to all of you. I personally have been using music significantly to enrich my own life. Like, for example, that's an example of a series of programs that I've been conducting in Nagpur. Kisse Filmi Nagmo Ke. So this series involves discussing trivia about how music was composed, especially in the golden era of music, and small stories associated with this. Coming to the last point, is music associated with longevity? In fact, literature, the world literature, is replete with this fact that music is associated with longevity. Interestingly, I did some research on that with regard to Indian musicians, and I found that some of the top A-grade musicians in India, classical musicians, they lived a very long life, unusually long. Ustad Alauddin Khan, the grand guru. Ustad Alauddin Khan was the guru of Ravi Shankar, Ali Akbar Khan, Annapurna Devi, all greats in music. And he died at 110 years of age. Pandit Ravi Shankar died at 92. Ustad Bismillah Khan died at 90. Gangubai Hangal, who hailed from Dharwad in Karnataka, died at 96. Pandit Jasraj, who passed away recently, died at 90. Pandit Bhimsen Joshi, 88 years. Interestingly, if you look at film singers, it's just an observation. I mean, I don't know how much substance is there to it. Hindi film singers who were more adept with classical singing and who were known to be very strong riyazis, they lived long lives. Like late Manna Dey, I think he lived the longest amongst them. He died at 94 years. Lata Bai is 91 today, still going strong. Asha Bhosle is 88, continues to be youthful and still active, still making music. So I don't know. I can't say for sure, but then maybe it is the classical music part which is helping here. If we compare that with Mukesh and Kishore Kumar and Talat Mahmood, with the exception of Mohammad Rafi, the other names that I took, they were not really into semi-classical singing. Now, again, I can't say that they passed away because they were not into classical singing, but these are facts. So, friends, I come towards the end of my talk. Thank you so much. Wishing you all a very happy and music-filled life. Here you can see Albert Einstein playing violin. Albert Einstein had been playing violin right since his childhood. He was known to be a good violin player. And he has once said that I attribute my science and mathematics partly to the violin I had been playing. So basically, he was trying to say that it is the music that enriched my brain in particular ways, so as to come out with the scientific theories that I could give. So friends, with that, I come to an end of the talk, and thank you so much. Over to the respected chairpersons.
Thank you, Dr. Bhave, for a very exhilarating and I would say enthralling talk, and with so much of details and nuances about musicality. And we all know that we love music, and those who are here, they are probably music lovers. And so basically, I hand over the mic to the moderators if there are some questions and some question answer sessions. So kindly go ahead with that, Dr. Aleem and Dr. Amrit. And after that, there will be comments from Dr. Rajkumar Saab, and then a few concluding remarks from the senior people. Dr. Aleem. And
Thank you,
Dr.
sir.
Thank you, sir. Thank you.
Thank you, sir. So there are questions, some questions in the personal inbox also.
Yeah.
So shall I start with my observation that we can use music as a non-specific add-on to almost all the situations?
Yeah. As I said earlier, we can use music medicine significantly as long as it does not intrude our therapy. Like I would not have music in my chamber in the clinic, because the background music can interfere the one-on-one communication, though I might have it in the waiting room. But barring the chamber, I think music, a background music of a soft, soothing type would be relaxing and definitely helpful.
Sir, Sir, your talk was actually soothing. I think if music therapy is what it is, the way you talked was absolutely soothing, and it was therapeutic for us. So I wanted to ask a question, and that came in the chat box. I have two waiting rooms where I play music, background music. So I have a people. There's some very educated urban people and then some semi-urban people. So many times there is an argument that why Hindi songs, music is being played. Sometimes people tell why Western music is being played. I have little more propensity towards Western music. And I saw a question in the chat box also. And can Indian music benefit Western non-Indian patients? Can Western music be healing for Indians? So this question came like,
Yeah.
because I stopped playing music for some time when there were, people would come and tell you play this music, you play that music. The background music you're talking about.
If I can add a small observation, Amrit likes any music that is played in the disc. It could be Indian or
Yes,
Western.
yes. Loud.
I
Very
think
loud.
that's a very interesting question. And my hunch is that it would help. Like Indians listen to Western music or vice versa. Because in music's helping role, it is basically the notes and the tempo which help. Now, no matter whether I'm listening to Mozart playing the 40th Symphony or whether I'm listening to some Hindustani classical song. So basically, the tempo, a slow tempo, melodious tune, I think that is what helps. So my hunch is that, yeah, it would.
Carrying forward from what Alim spoke, I actually wanted to ask the question Alim spoke for me. When I'm very, very down, when I'm very, very depressed, when I'm, I go to a place where the music, where nobody knows me and the music is absolutely loud, spot on, very, very loud. And sometimes it's very, very healing. Everybody tells when you are down, why do you go to such places where there is, but then I love it. The music has to be loud, rash, like the DJ music. I don't know why, how it heals to me, but it's healing. Once in a while, once in a...
Amrit, there are studies also and which says that during depression, the loud music is going to work for you. And when you are having negative symptoms, then probably the soothing kind of music or is going to help you, because in the depressed state of mind, probably you are required to have some jazz or some very very loud music. So that is there are studies also which say that. So you are not wrong in doing that. And taking ahead of Dr. Bhavel sir's question, is that probably, sir, if you are in a, if say I am going to see you and I am sitting in your what you call, in your waiting room, maybe for 5-10 minutes, not as a music therapy but as a music medicine. So in that point of time, probably I would love if I know a certain song which I have heard before and which I have liked before. So if that song is played, then probably I will enjoy it more as compared to any Western music about which I have no knowledge. In music therapy, it may work, sir, what you are saying, that maybe notes and maybe all other things which is actually similar when you are going into details of it. But when you are for a very short period of time, and then probably the song which you know is probably going to be more soothing or comforting for you for a brief period of time. That is my observation. Thank you.
Can I respond to that? My
Yes.
thought is that maybe when a number of people are sitting, light music, especially light vocal, may not be appropriate because the choice in light vocal varies significantly. Like, for example, I might think that soft, soothing numbers by Mohammed Rafi are wonderful, and I play it in my waiting room. Now, some youngster sitting in the waiting hall might say, "Ki kya boring lага के रखा वो पुराने घिसे पिटे गाने." So, the choice varies. If I'm sitting in the VIP waiting room of some doctor, which many doctors have, they have VIP waiting rooms, I'm alone. And if I'm asked, "Kaun sa gana lagaun?" background way, so I might say Mohammed Rafi ka. And when I listen to Mohammed Rafi, then that will definitely help me. But about a group, I think a non-specific music helps. And when I say non-specific, I basically mean instrumental music. Because instrumental music comes without much specificity slow in tempo, like examples that I gave earlier, santoor, sitar, bansuri. So slow paced, these kind of musics, I mean, they are soothing, not intruding into your consciousness so that you don't form an opinion of it. You are not biased against it.
Yeah, sir. And in this regard, I've seen people they're playing this fireplace sounds and rain that is dropping. So people are using those sort of natural sounds that are produced. Sir, two-part question. You touched upon the area mindfulness and music, and taking it further, use in insomnia, because it can be very easily suggested. So your comments on these two aspects.
Yeah. First, mindfulness. I think you know that mindfulness is basically getting ground in the moment, focusing on the ongoing things rather than thinking of the past or the future. Like when we say mindful eating, we basically mean that focusing on the sensations you are having in your mouth, the masticating movements that you're experiencing. So when you listen to music mindfully, perhaps with the eyes closed, then and you focus on the lyrics, you focus on the voice of the singer, you focus on the wonderful tune that you are listening to. That basically is the mindfulness and music. And I think it helps significantly. Like if we listen to the songs which are our favorite more mindfully, we might be able to enjoy them more. And the second question, sorry, what was the second one?
Regarding insomnia, sir, can we use it in as an add-on?
Yeah, certainly. More commonly, it's the slow, relaxing kind of music, again, instrumental, which is used as a relaxing agent before the sleep sets in. So this background music goes on, it helps you relax. And we know that anything that helps you relax can induce sleep earlier. Some, in fact, many of my patients claim that they put on their favorite music on the earphones. It could be loud music, it could be fast-paced music, and they are able to sleep better. Now, to each his own, but I think largely it would be a slow tempo music that works.
Amrit.
Sir, yeah.
Yeah,
So there
I
is a
have a point.
question again, sir. Tufan, sir.
Yes, I would like to ask, put my ideas here.
Yes, sir. Sure.
Dr. Sudhir. I strongly feel, so we are discussing music as a therapeutic agent which has got neural specificities, the definite areas which are responsible for that, for appreciation of the music. And maybe we don't have the knowledge particularly about the neural circuits and hormonal parts involved in that to a great extent. But in principle, you have to accept that there can be individual specificity, means which individual in which disease condition will respond to which music. That is there any reflection on that specificity in respect of individuals? One individual being relieved of depression by one type of music, the other individual by another type of music. And in different disease conditions in general, different types of music should be specific, so that the perception of the clinician has to be there. Number two, most of us cannot sing, so we have to use recorded music and use it all which does not have a language instrumental will be better. Can we have a guideline for that, or is there any guideline?
So there are no definite guidelines as such. I would say that there are both generalities here and specificities. Generalities in the sense that the tempo and the softness of music are known to induce particular emotional state, and fast tempo and absence of softness is likely to induce another emotional state. So that is there. Now, when it comes to light music, I think we have to go by the choice of the client. For example, the study that I conducted recently on, as I said, Hindi light music with patients of MDD. What we did was we created a very large bank of songs. About 90% were filmy songs, both new and old, and about 10% were bhajans and folk songs. And it was a large bank because for each singer we had selected we had a bank of about 50 songs each, like 50 songs of Kishore Kumar, 50 songs of Lata Mangeshkar, and so on. And then we presented the list. We had a self-constructed questionnaire for the patient about his musical attitude, his musical knowledge, his musical preferences. And we ask the patient to select what would he like to listen to in music therapy, or let me call it music medicine. And the patient would have a headphone and listen to that particular kind of music. For example, if someone said, I like Mannade more, then he would select more of Mannade songs and we would play that for 1 hour roughly. And the patient was instructed to listen to that in particular way. So when it comes to music with lyrics and light music, I think there is a significant specificity, as you correctly said, because I may not like Sufiana songs. I mean, someone, Kailash Kher might sing some of his best, but then if my liking is not in that direction, I would not do it. So, as I said, there are both general issues and specific issues here.
Yeah, sir.
Alim, my turn.
Okay, go ahead.
Sir, one interesting question is there. And
Yeah.
I also, can listening to sad songs in depressed mood exacerbate symptoms or lead to suicidal thoughts? And can listening to loud music exacerbate mania?
Yeah, I do not think it has been researched adequately. But my hunch is that listening to sad songs is likely to worsen depression. Because when we say sad songs, they come with sad lyrics. Now, there is a caveat that interestingly, even sad music is pleasurable for a person who is mentally healthy. Even sad music. You listen to Jaane Ka, I'm sorry, I'm using all the old songs as examples because those are the ones I'm more familiar with. If you are listening to Jaane Kahan Gaye Wo Din Kehte The Teri Yaad Mein Nazron Ko Hum Bichhayenge वगैरह, sad lyrics, but you get drowned in it, you go with the flow, you enjoy that. But for a patient of depression, I think it may not work that way because that's kind of reinforcing his depressive thinking. It may not help. As far as worsening mania is concerned, I think it would exacerbate the manifestation of mania rather than actually at a more biological level worsening it. A many patient who listens to a DJ kind of music might dance in a more animated manner and maybe with more louder movements. But I do not think that it can really worsen mania. Though temporary, that manifestation would be much more than any other person who does not have mania.
Yeah,
Alim.
suppose, sir, in migraine, people have phonophobia. So they might happen to dislike the music they like. So mood changes lead to different approach to music. So your take on this thing?
I fully agree with that. I think you gave a very good example. Like in migraine, music may not really help. I think this is a kind of extension of what Dr. Dalal said earlier, that it depends largely on the condition and the kind of music. Now, in certain states, certain clinical states, some kinds of music may not work. The music might seem too jarring. One may not really enjoy it, though it might fit into our concept of classical music therapy. But yeah, I mean, we can't generalize here. It's more diagnosis based. Like whenever music therapy has been used, it has more commonly been used for specific diagnosis. Like for schizophrenic patients, use this kind of thing. For depression, use this kind of thing, and so on. Yeah.
Sir, as a medical practitioner, suppose a patient walks in and he is visiting my OPD, or he is admitted somewhere and getting discharged. So, what are the right places where music can be a good add-on, and what are the wrong places? In clinical practice, how do I adapt this angle?
I think I alluded to it earlier. My thought is, I could be wrong, and there could be people who think otherwise, but my thought is that every place in the clinic or the hospital, barring the doctor's chamber, I think that is the right place. It begins right from the waiting room to the inpatient room or procedure room, ECT room. So music can be used fruitfully at all these places. And but as I said earlier, perhaps not in my chamber. Now that's again perhaps. I don't think there are studies on that music is being used in the chamber. But my thought is that it might interfere with the communication. Like some patients might find that kind of intruding the conversation.
So another interesting question is there's a observation. Sir, do you think standardization of music therapy is a possibility in future, at least in Indian settings?
I think there can be guidelines. Standardization in a strictest sense to the very grassroots levels, that is quite difficult, because as we know that it is based on the diagnosis, it is based on the patient preference, it is based on what kind of music is being used. So the number of variables to be matched are so many that I think standardizing it like an algorithm for depression, that's not possible. For most clinical conditions like akathisia, you have an algorithm. For non-clozapine responders, you have an algorithm. I do not think that kind of a thing would apply to music therapy, because it is so subjective and so preference-based that I do not think that we can standardize it to the extent that every small detail is spelled out.
And there's also an interesting observation in the chat box. Increasing the tempo of the drums, or maybe the the ghanti sound of the ghanti, brings out the trance and position syndrome in certain individuals.
Yeah,
We see it in a lot of
yeah. So if
very
ma'am can unmute and ask herself. Bhavesh sir, you.
Yeah. Shall I respond to what Amrut said?
Yes,
I think
sir. Yes.
this fast-paced music that is likely to bring on a dissociative state. I agree with that, because dissociative state is often induced by frenzied music. When the musical tempo increases, the frenzy increases. A number of bhakts are dancing or singing together, and then this lady she opens her hair and then starts doing all those things that we see in the possession states. So I think the frenzy here, now frenzy is typically associated with a fast-paced music. A slow music in Rag Darbari, that is quite unlikely to produce a dissociative condition, unless the patient for some reason is conditioned to that kind of music. But I think largely it would be music with fast tempo.
Okay, sir, regarding effectiveness, or if we can say the effect size. So if we cannot standardize, if we cannot study it very properly, so how can we recommend it to a patient, or usko evidence mein, how do we evaluate it in evidence wise? It is very easy to say that it is a non-specific measure, general measure, you do it. But if we talk of evidence based, effect size kya hai music therapy ka, if there are no standardizations?
Yeah, I think yeah, as I alluded to that earlier, there can be generalizations, like though there can't be great specifics, but generalizations are there. What kind of tempo? What if you are using a rag with what kind of mood? Like for example, a patient of depression, if you are using a rag which kind of elevates, like rag Yaman, rag Marubiyag. So these are kind of lifting rags, so they help. But if you use something very serious like rag Bhairav or rag Darbari, I'm not sure that it will help. So generalizations can be made, and I think most of the music therapy and the evidences that have come from it, they are based largely on generalizations. So they are not very individual specific, because that's difficult, because individual specific, the research is quite difficult.
I think we have covered most of the questions. There is a last question. Is music more beneficial with eyes closed with the intention of blocking other senses? And can it help in sports performance such as rhythmic gymnastics?
Yeah. I think unless we are participating in a kind of social way of celebrating music, when the eyes need to be open, music with eyes closed would be a better idea. Because the music with eyes closed gives a better mindfulness than music with eyes open. Because yeah, with eyes open, you have got so many visual cues that you can't really focus on the auditory input that you are getting. Yeah, so eyes closed is a better idea. In
And
fact,
can it
that when any of us enjoys our very favorite music, we tend to automatically close the eyes and maybe sway to the music or tap with the music. So I think closing the eyes is an inherent part of enhanced perception.
sense.
Yeah.
Yeah, and can it help in sports performances?
It can. Fast-paced music should help, because fast-paced music, it does energize, it does build up tempo, it does increase sympathetic hyperactivity, which is needed in things like heavy-duty sports. So yeah, it should.
Like even in gym, sir. Even
Yeah,
in
exactly.
gyms, we play a lot of loud music.
Yeah, I think gym is a very good parallel, because gyms usually have this loud music with a fast tempo, and then you are doing elliptical or treadmill, and you tend to go on with the tempo.
Alim, we'll hand it over to the chairpersons.
I think so, sir. We have covered all the questions. Thank you, sir. Thank you. And we are eagerly waiting for the dessert. After the
After the
chairpersons,
thanks.
Dr. Rajkumar, sir,
Yeah.
your wisdom.
It was definitely a session that I have enjoyed. My one submission is I know very little about the nonsense of music which you expressed up. I don't know the ragas, I don't know the tunes. That is very difficult for me. I never have studied it or known about it. But I have used music in a great manner in all my patients as an add-on. I usually say, pick up a hobby, make it as a hobby. And instead of just listening, participate in it. Maybe vocal, maybe music, instrumental. Learn something so that helps you to soothe up yourself and come out of the situation faster. And it definitely has worked out. I agree with that. Frenzied music, as Dr. Amit said, yes, it does cause a certain position states, because if you look into the culture, the temples, wherever such situations are there, where the possession is to be brought, there is a frenzied music which is going to precede that. And when it goes to the high, you would get those dissociated states over there also. I definitely always advocate every one of us, at least 15 to 20 minutes, sit down, listen to music, if possible, sing along with it if you don't have a good voice. And that has worked a lot in the therapeutic value. I wouldn't say it is evidence, but it is maybe my personal experience. Thank you, Dr. Bhave. It indeed was a pleasure listening to you and knowing a little more about music from you.
Thank you, sir. Thank you so much.
Sir, Dr. Rajkumar, sir, before closing your dessert, sir.
Well, my submission is I sing only Mohammad Rafi songs. So maybe I'll catch up with Mohammad Rafi.
You are most welcome, sir.
सुहानी रात ढल चुकी, ना जाने तुम कब आओगे. सुहानी रात ढल चुकी, ना जाने तुम कब आओगे. जहां की रुत बदल चुकी, ना जाने तुम कब आओगे. सुहानी रात ढल चुकी, ना जाने तुम कब आओगे. नजारे अपनी मस्तियां दिखा दिखा के सो गए. सितारे अपनी रोशनी लुटा लुटा के सो गए. हर एक शम्मा जल चुकी, ना जाने तुम कब आओगे. सुहानी रात ढल चुकी, ना जाने तुम कब आओगे. तड़प रहे हैं हम यहाँ, तड़प रहे हैं हम यहाँ तुम्हारे इंतजार में, तुम्हारे इंतजार में। खिजा का रंग आ चला है मौसमे बहार में, खिजा का रंग आ चला है मौसमे बहार में, मौसमे बहार में। हवा भी रुत बदल चुकी, ना जाने तुम कब आओगे, सुहानी रात ढल चुकी, ना जाने तुम कब आओगे। Thank you.
Wonderful, sir, wonderful. Well, let us share.
Excellent.
That is on Star Maker. So if you search him, you'll find his renditions there.
That was something which all of my friends instigated me. I never used to sing with music till about 2 months back. It just wouldn't get into me at all. 2 months back, everyone prodded me into it. I said, okay, let me try. And I tell you, it was a really good experience. Just to inform you, I have recorded 140 songs of Mohammed Rafi in these 3 months now, and I enjoy it. Okay, voice may be not to that quality of what Rafi is. I can't match that at all, but I am able to enjoy that. That's what is important to me. Good night to all of you.
Excellent.
That's what is very, very important. Now,
Excellent.
there is a jawab from the learned speaker, sir. Your desert.
So I would not to call it a Jawab. Rajkumar sir is respected.
जवाब मीन्स योर डेजर्ट. अब डेजर्ट तो कुछ अच्छा हो भी सकता है ना सर. गाजर का हलवा है कि मूंग का हलवा है.
I know, certainly. सर के जो ingredients थे मेरे वही रहने वाले हैं. Because like Rajkumar sir, I am a huge fan, not a huge fan, a bhakt of Mohammed Rafi. I consider Mohammed Rafi a god when it comes to his 1950s and 60s song. So maybe one stanza of a song from a famous movie, Hum Dono. It was composed by Jaydev, wizard composer. I think all of us have heard this song. It's a very popular one. अभी न जाओ छोड़ कर के दिल अभी भरा नहीं, अभी न जाओ छोड़ कर के दिल अभी भरा नहीं, अभी अभी तो आई हो, अभी अभी तो, अभी अभी तो आई हो, बाहर बन के छाई हो, हवा जरा महक तो ले, नजर जरा बहक तो ले, ये शाम ढल तो ले जरा, ये शाम ढल तो ले जरा, ये दिल संभल तो ले जरा, मैं थोड़ी देर जी तो लूं, नशे के घूंट पी तो लूं, नशे के घूंट पी तो लूं, अभी तो कुछ कहा नहीं, अभी तो कुछ सुना नहीं, अभी ना जाओ छोड़ कर के दिल अभी भरा नहीं. Thank you.
Wonderful, sir. Wonderful. Sir, I think you both are
तो ये सुधीर
are
भावे
blessed,
की
sir.
गाना के बाद तो कोई नहीं जाएगा ना,
बहुत
और
अच्छे,
तो
बहुत
और
अच्छे।
डेसेट होना चाहिए ना.
So now it is my pleasant duty to conclude this today's session.
As well as the deserts, sir.
अरे साहब इन बड़े बड़े लोगों के सामने. अच्छा चलिए. I am a huge fan of Hemanto Da, so I would like to sing a few lines only. मुझे गाना बहुत याद नहीं रहता है, but still I will try. तुम पुकार लो, तुम्हारा इंतजार है, तुम पुकार लो, रात चुन रही है, बेकरार है, तुम्हारा इंतजार है, तुम पुकार लो. Thank you.
Wonderful, sir. Wonderful.
Wonderful, sir. Wonderful. Sir, I think we have too many hidden gems. Sir, एक इसका section start करना चाहिए. We have too many good singers.
Too many. And there could be many here over also.
हाँ,
Because
many
I
here
was-
who would be.
I was looking at the gallery view, I was seeing Dr. Archana and Dr. Sachinai were waving their heads along with the, and they could be good singers. If so, please come forward. ये हमारा ही family है ना. You sing, Archana?
Sir, I think Amrit is not here, so you have to do the Thanksgiving part. Tufan, sir. And your comment, sir.
So I have a simple comment which can be one line answer from Dr. Sudhir. Dr.
Sir, I
Sudhir,
think Fabian is there. Fabian can put in a few rhythms.
Okay, Fabian, please.
Fabian, are you ready to go?
Sir, I don't sing at all, not for the love of anyone. But I just wanted to comment that I do a community connect program every Saturday. We started in the lockdown called Man Darpan. This Saturday will be the 73rd episode. And in every episode, I use one of my patients or people who are invited to sing and give across a motivational song for the evening. And I'm happy to say that Dr. Rajkumar also has been on our show. We've had talented psychiatrists sing on our show as well, patients, well-wishers, and the theme is just to motivate people and give them lovely lessons of life that come through our songs, our Bollywood songs. So that is how I use music with my patients. Just a comment.
Lucknow is famous for music. Halim,
Pardon, sir?
Lucknow is famous for music.
Yes, sir. Yes, sir. It is.
Yes.
Sir, I think if you want to stop Fabian's program, then he can invite me.
So, Dr. Sudhir, a simple question maybe. There are certain few music therapy courses being run in India also, Indian Association of Music Therapy. And in Bombay, there is one institute, MET Institute of Alternative Careers like that. And in Chennai, there is an association of the Indian Institute of Medical Music Therapy like that. Do you have any idea about what is the composition of their course and what do they really give?
Yeah, I have some idea. Like, I think the most of these courses, they need someone who has done at least a graduation in music, BA with music as one of the subjects. And the composition of the curriculum is quite wide based. In fact, it's an impressive curriculum. It has elements from psychology, from neurosciences, something on the different kinds of illnesses, some basics about illnesses which can be treated with music therapy. So these are kind of comprehensive courses that are meant to equip the person with both the knowledge of music, how it works in the mind, in what kind of patients it works. That's the usual trend that these Indian schools follow. Yeah.
Is there any online course available, or it is only
There are online courses for music therapy. Yeah, there are. I may not be able to give the specifics here, but I have read
See,
about
but I was thinking of possibility of encouraging our local singers who have a degree in music to opt for this as a side profession and help us.
Yeah.
I can only listen to Dr. Sudhir, I can only listen to Dr. Dalal and Dr. Rajkumar. All are my good friends. I can sing well. हम सुनते ही रहेंगे. And thank you very much. हम सुनते ही रहेंगे. The whole deliberation was fantastic, quite observing, and there had been a lot of discussion. We heard around 80 to 90 questions, which were summarized by Dr. Beam and Dr. Amrit. And this I sincerely thank Dr. Sudhir Bhave. We had talked about music therapy long ago, and today it came out. Thank you very much. And I'm very happy that Dr. Pranab Dalal, Past President IPS, and my dear friend Dr. Rajkumar, वो भी दिखाई नहीं देते. हाँ है, नीचे है, पर्दे के पीछे है. And Alim, Amrit, and all the team behind Shajiyas, etc. I thank all of them at last parent. And I also thank Indian Psychiatric Society for giving us a Odisha State Branch, to giving us a free hand to run Trust Amusing, 60 years, 60 sessions, and maybe certainly we will be completing, having a century. And with this, I thank everyone. Maybe we can have a more practical session on this, if time permits and if Dr. Sudhir Bhave permits.
Sure. In fact, please allow me to say that I really feel indebted to you for giving me this wonderful opportunity with such a large audience, such an interactive audience, and on a topic which is very close to my heart, as like I think most of us. So thank you so much, sir.
Today you have come close to the heart of all the audience, all chairpersons and the speaker. Thanks, everybody.
Thank you, everybody. Thank
Thank you
you.
so much. Thank you, everyone.
Good night. Good night. Good night.
Good night, sir. Good night. Thank you, sir. Thank